Welcome to my world. Code STEMI. Today I'd like to tell you all about heart attacks. Another word for heart attacks is an MI, myocardial infarction, or a STEMI, ST elevated MI. I would like to talk to you about early recognition, early intervention, and risk modification. Every 43 seconds, someone in the United States has a heart attack that could have been prevented. I'm a registered nurse at St. Thomas Rutherford Hospital. I've been in healthcare for over 35 years and in critical care a lot of these years. Currently, I'm the manager of the cath lab, and this is actually the unit that we work in. The goal today is for you to understand the better warning signs of a heart attack. We often say that time is muscle, and I want to help you understand what that means. Our focus again is on early recognition, early intervention, and risk modification. Remember at the beginning that I said that every 43 seconds, someone in the United States has a heart attack. Just in this introduction, 2 people in the United States have had a heart attack. I'd like to share with you some ways that you can avoid this. Some risk factors are modifiable. According to the Mayo Clinic, smoking, stress reduction, diet, lifestyle modification, and people who are of a lower socioeconomic status are more likely to have a heart attack. According to one source, smoking and heart disease, smoking narrows the arteries that lead to the heart, causing blood clots to build up, and you're more likely to have a heart attack. Stress, especially with shift workers, so if you work second or third shift, you have a higher likelihood of having a heart attack. Diets that are high in trans fat, which are things that you'll find in the middle of the grocery store, like in your prepackaged foods and hot dogs and bologna, are higher and are more likely to lead to heart attack. According to Dr. Marola, lifestyle changes engaging in a healthy lifestyle can decrease, would prevent 80% of the first-time MIs in men. And the lower socioeconomic status, like we talked about, they are also more prone to having less health care and more other health diseases such as diabetes and hypertension. There are also diseases that are linked to an increased risk of heart attack. Diabetes or elevated blood sugar is one, so it's very important if you're diabetic to control your blood sugar. Hypertension or high blood pressure increases your risk of a heart attack. Obesity and high cholesterol and triglycerides. There is a study called Heart Attack Centers from the Disease Control and Prevention that links these things also to increased risk of heart attacks. One of the non-modifiable risk factors are genetics. First relatives such as your mom and dad, if they've had a heart attack, are at increased risk. And a study done by the American Heart Association says that there are 27 genetic variants that if you're born with, you're at an increased risk for a heart attack. Now I'd like to look at the early signs of a heart attack. These are vital that you understand so that if you start to have these or your loved ones do, you'll know how to react. You've heard of chest pain. Understand that chest pain can also be arm pain, jaw pain, or back pain. In women, they could be non-specific aches and pains. In diabetic patients, it could be silent. You won't even know that you're having a heart attack. And some people say that they feel like they have a pressure in their chest. You can get short of breath. There's a feeling of impending doom. People who never want to go to the hospital are begging you to get them to the hospital. People can be nauseated or vomiting, and indigestion. Early intervention is crucial if any of these signs are happening. Remember that not all hospitals are created equal. It's very important if you're having any of these signs that you call 911 and don't drive yourself or your loved ones to the hospital. The emergency medical people have equipment that are ready if your heart stops or starts to act funny. They can give it a little jolt and get it started again, and if you're in the car, you don't have that anyone to help you. So call 911 and they will come. When they get you to the hospital, they'll call a code STEMI, and teams like the ones that I work here with will jump into action. They'll do an EKG, which will show us a picture of what your heart's doing, and then we'll bring you into the cath lab, which is this area that we're standing. One of the things that we look at are door-to-balloon times. The survival rate greatly increases if we can get you into this cath lab and get your blockage open with a balloon or a stent. I want to show you what we do. This is called a sheath, and this is one of the things that the doctor will put into your femoral artery. Once he gets this into your artery, he feeds a wire, it's a very thin wire, through this sheath up into your heart, and then over this wire he puts this catheter. This catheter, I don't know if you can see, but we'll feed it from the femoral artery up into the heart here, and then we'll put contrast or dye into your heart, and we take pictures with the specialized x-ray equipment. These pictures will show us where the blockage is and where to put the stent. If it's in a crucial place that we can't handle, then you'll have to go for bypass surgery. The recovery for bypass surgery is a lot longer. You're out of work for about 6 weeks, and you're in the hospital for about a week. If we put a stent in, you're in usually just overnight or maybe 2 days, and then you'll go into cardiac rehab. My purpose today has been to inform you of the benefits of risk modification, early recognition, and early intervention. During this speech, 8 people have had heart attacks. Education is key to decrease that number. Live healthier lifestyles, recognize your signs and symptoms, activate the EMS. It makes a difference for your survival and for your loved ones. Thank you.